My name's Colleen Tewksbury, and I am a registered dietitian with the Penn Medicine Metabolic and Bariatric Surgery Program. And this is our online patient information session video. The purpose of this video is to give you a sense of what you can expect if you decide to move forward with pursuing bariatric surgery at Penn Medicine. Here at Penn Medicine, we have been in practice for more than 2 decades. We are the largest standing bariatric surgery program in the area, performing approximately 850 procedures each year. And why does that matter? Why do we talk about how many procedures we actually perform? It's mainly to emphasize how specialized our staff is. We have staff that focuses on bariatric surgery day in and day out. That includes our surgeons, our advanced practice providers and nurses, dietitians, psychologists, even our anesthesiologists. We are focused on bariatric surgery with what we do day in and day out. Now, as a part of that, we also have access to some of the latest treatment options available within the field of bariatric surgery. This includes enhanced recovery to get you in and out of the hospital faster and recovering and back to your everyday life quicker, reducing the number of opioids that are used within the surgical process, and then also offering robotic-assisted surgery as a part of our program. Now, all of these features have led us to be the recipients of multiple awards, certifications, and accreditations. We have a fantastic team of surgeons. Currently, we have 9 surgeons practicing at multiple locations and also operating at different hospitals. Here you'll see each of our current surgeons who are practicing within Penn Medicine. You can go to our website and review your surgeon. You can see what their background is, where they trained, how long they've been in practice. Also, you'll be able to see where they practice, at what locations, which hospitals they operate at. So before calling in for an initial appointment, we strongly encourage that you go to pennmedicine.org and look through all of our providers. With the bariatric surgery process, we consider this to be a marathon, not a sprint. It is a lengthy process that starts with this video, getting some more information as to what's to come. From here, if you decide to continue on with this process, you would schedule an initial consult. Now, at that initial consultation, you would meet with the surgeon that you scheduled with, and you may discuss surgery at that time. You'll also meet with a nursing provider or an advanced practice provider and review your entire medical and surgical history and any testing that might be needed prior to scheduling surgery. Last, you'll also meet with a dietitian and do a full nutrition assessment. We'll learn a little bit more about you from a food standpoint. From there, you'll enter into what we call medical weight management. Now, this time period, the purpose of it is to go through the preoperative counseling period. It's your period of preparation, starting to look at what you might want to practice prior to surgery. Additionally, this is your time point to complete all the testing that is discussed at that initial appointment. From there, we do not schedule surgery until that medical weight management component is completed. Much of this time period is dictated by your insurance and also your medical and surgical history as to how much time this might require and also how much testing you may need to complete. On average, this can be anywhere from about 4 to 6 months for most people starting the bariatric surgery process. At that point, we schedule surgery and all the final steps prior. In terms of surgical options, there are many different bariatric surgeries that are available. The 2 most common, and the 2 most common that are performed here at Penn Medicine, are a Roux-en-Y gastric bypass and a vertical sleeve gastrectomy. A Roux-en-Y gastric bypass is oftentimes also called a gastric bypass or just a bypass. A vertical sleeve gastrectomy is oftentimes simply referred to as a sleeve. Each of these procedures have different potential benefits and potential risks. We encourage that everyone meet with their surgeon individually to discuss your medical and surgical history and your health goals to see which operation would be the best option for you. After surgery, for recovery, we do recommend that everyone follow up, typically within 2 weeks of your operation, again at 6 weeks post-operatively and at 12 weeks. At each of those visits, you would typically meet with both your surgeon and your surgical team and a dietitian to advance your diet and prevent any potential nutrition complications. After there, we do recommend that individuals follow up for the rest of their lives. This is chronic disease management, so we do recommend that individuals come in at 6 months, a year, and then annually at minimum from there on out. At those visits, you meet with an advanced practice provider who is specialized in caring for individuals who have undergone bariatric surgery long term. You typically would not meet with your surgeon after this period unless you have a surgical issue. You would also meet with a dietitian at each of these visits, again, to talk about your nutritional status and to prevent and minimize the risk of developing any nutrition complications. Now, at Penn Medicine, we are an academic medical facility, and as a part of that, we do also participate in many different research trials. It is embedded into Penn Medicine as a whole, as you'll see here in our vision statement. Now, obesity research specifically dates back all the way into the 1950s at Penn Medicine. So doing this research allows us to be able to provide you with the latest treatment options, but this research participation is voluntary. It will not affect your care here whether or not you participate in a research study, but we do want you to keep in mind that at some point in time throughout your care, you may be asked to participate in a study, and we hope you keep an open mind. So why would you want to choose Penn Medicine? We are a high-volume, experienced program with specialized staff here to guide you through every step of the process and help support you lifelong post-operatively. We specifically specialize in high-risk cases to be able to manage individuals who may not be a candidate for bariatric surgery at other centers. We do provide individual attention from all of our providers who are subspecialists to provide the most supportive environment that we can for all of our patients. And as a part of that, we do have access to the latest treatment options before they may be available elsewhere in the region. What are your next steps after this video? First and foremost, before you give us a call, you want to check with your individual insurance provider whether or not you have bariatric surgery coverage. From there, give us a call on our main scheduling line listed here to schedule your first visit and your initial consultation. Now, for that consultation, we do want you to plan for it to be up to 90 minutes. And the reason why it's a little bit more lengthy is, again, you're meeting with the whole team. You're meeting with the surgeon, the nursing team, and also the nutrition team. So it is a bit of a lengthy initial visit. So please be prepared for that. Thank you for joining us here today. Hopefully you got a good sense of what you can expect if you decide to pursue bariatric surgery with us here at Penn Medicine. I hope to see you in the office sometime soon.